Healthcare Accountability, video number 3. This is a continuation of the topic that we got into in video 2. What is it that we're accountable for in healthcare? And it's a big area that I just wanted to be able to focus on in this particular video, our third in this series. And that is, we're accountable for the security of our patient records and the privacy of our patients. Now, that's a recent advent. It's not that we years ago didn't know that we should, as the right thing to do, to keep our patient information guarded and protected, but it's now part of federal law, and then securing that record once we've obtained it, whether it be a history and physical or a diagnosis information in detail, or treatment plans, progress notes, orders, all of these types of information are collected as we treat patients. And so keeping those elements of information secure is of utmost importance to physicians, to hospitals and clinics, and the security is becoming more and more complicated. Let me explain. Years ago, when there was a paper record, it was more basic and much more simple to secure paper records. You kept them in well-organized cabinets inside of rooms, most likely locked with badge access as we got a little more sophisticated with our technology, so that you knew who was going in and out of the room. And then obviously you'd have security at night and off hours for those records to make sure that they weren't obtained by anybody that didn't have a need to know. But then the legislation came about, we call it HIPAA, where specific federal protections were levied for the protected health information. And that's any information that is identifiable to one patient, or even may be identifiable to one patient, is federally protected now, with criminal penalties associated with the disclosure of that information that's not approved by the patient, or that's not a part of the operations of the organization, or in a part of treating the patient. So it essentially puts the burden on the shoulders of the provider and those that are caring for the patient to take very close care, guarded care of the records that we obtain. But now, in the last 5 to 8 years, the proliferation of electronic health records has put all of that information into the electronic realm, which is a really good thing from the standpoint of being able to obtain usable, actionable data from the electronic records. But it's not necessarily a good thing from a security standpoint, because the securing those types of records has become much more complicated. There's an entire hacker economy, if you will, that's going on, where people are being trained how to access records such as medical records. And medical records are far more valuable than just your name, social security number, birth date, even a credit card number. Medical records on the black market or in the hacker world have a much higher street value. So the burden of responsibility on the part of the organization or the provider to secure those records is very high. Let me give you one example of the type of nefarious work that hackers are doing today in healthcare. They are putting some organizations at risk by entering through their security measures, hacking through those firewalls and those protections, and then locking the records so that the organization cannot access them. And they do that to obtain a ransom or a sum of money most often. And it can range anywhere from, I've heard, $8,000 to as high as just under $20,000. So it's not exorbitant amounts of money that the hacker ransomware hackers are requiring or requesting. But it is very annoying because the organization has no access to their patient records. And we see articles nearly weekly of new ransomware attacks. And I believe there are organizations that are infected with ransomware that we never hear about in the public, potentially. So the burden is high. And these ransomware hackers will lock up the records electronically. You don't know who they are. You don't even know where on the planet they are. But yet they have control, locking control of the organization's records. In order to get those records back, they generally have 5 to 7 days to provide payment for the ransom, and in order to get the unlock code to be able to get access back again to their records. It is a very difficult and huge problem for healthcare today. But to secure those records is a primary responsibility of any healthcare organization, and there are federal protections, including criminal penalties, associated with the mishandling or misuse of those records. When a record is disclosed or information that's protected is disclosed by mistake or even by intention, the patients affected have to be notified. It's one of our requirements, and it's another form of accountability for healthcare to be able to, or to be required or compelled to notify the patient that their records were inappropriately accessed. And if the numbers of patients affected are high enough, then the public has to be aware that there was a breach, and the requirement is to put that breach disclosure or that breach announcement out in the public, so that the public is aware of the breach and how many records were affected. That's a pretty high bar of accountability that we didn't see 10 and 20 years ago. This is a more recent event that this new level of accountability is coming to healthcare. And I assure you that healthcare organizations across the country take the responsibility to keep secure the protected health information that we're entrusted with and keep it highly secure. So that's just another, it's a continuation, if you will, of video number 2, where we are answering the question, what are we accountable for today that maybe we weren't 10, 20 years ago? Well, security of records is pretty big. Thank you, everybody.